For those diagnosed with Alzheimer's disease, there is good news as a new treatment option has recently emerged. This morning on Ask a Specialist, we'll talk about what you need to know with Dr. Abraham Chung, a neurologist at the Queens Medical Center. Aloha and good morning, Dr. Chung. Thank you so much for stopping by with us.
Thank you for having me.
So the last time you spoke about this topic, you talked about the difference between Alzheimer's and dementia. For Alzheimer's, how is this condition treated?
Yes, there are three main treatment approaches. The first is supportive treatment. That means taking appropriate steps to make sure that the patient is safe and that their personal interests are protected. As you can imagine, as the memory problem gets worse, people may make mistakes with taking their medicines or handling their finances, and other situations may come up. And coming up with the right strategies to protect them against those potential complications is important. The second treatment approach is symptom treatment, and that is the traditional medicines that we've had available for decades. The exciting development is that in the last couple of years, we have a new disease-modifying treatment that has become available, where we are actually affecting the accumulation of amyloid plaques in the brain that causes Alzheimer's disease. And by doing so, we can slow down the pace of the disease progression.
Can you talk about this new treatment option that patients might now have?
Yes, simply put, it's immunotherapy for Alzheimer's disease. So antibodies are infused into the body and they travel up to the brain and target the amyloid plaques. The immune system identifies the antibodies as a homing signal and helps to clear away the amyloid plaques from the brain. The things to keep in mind is that the treatment is administered as an infusion into the blood, and the schedule for the treatment is once every 2 weeks. The other issue is that any type of infusion treatment can be very expensive. And the good news is that Medicare is covering this treatment.
What are the risks and benefits of this new type of treatment?
Well, the main benefit is by clearing away the amyloid plaques in the brain, it slows down the pace of the disease course. So the memory decline and the other aspects of problems that we see in Alzheimer's disease, the decline happens more slowly. But it does come at a cost. Unfortunately, the potential risks are brain swelling and bleeding in some of the patients. So we do have to be very careful to monitor the patients who are receiving the treatment.
Who might qualify to get this type of treatment?
Yes, so there are rigorous inclusion and exclusion criteria that are in place to ensure that the right people get the medicine. First and foremost, this is a treatment for Alzheimer's disease, and so appropriate testing needs to be done to confirm that the disease is in fact Alzheimer's disease. And then, of course, because of the concern for brain swelling and bleeding, we need to make sure that there are no other factors that may increase the risk for such complications. And an important point to keep in mind is that the FDA has approved this treatment only for patients who are still in the early stage of Alzheimer's disease.
Yeah, great advice. And to learn more about the services provided by Queens Neuroscience Institute, you can just visit queens.org, just click on services, then click on neuroscience, or you can call 808-691-8866. Dr. Chung, thank you so much for being with us this morning and sharing all this new information.
You're welcome. Thanks again for having me.